Hi friends, welcome back. I'm Hope, and today we're talking about something that a lot of pregnant exercisers worry about: lying on your back. You've probably heard this advice to never lie on your back and that it will hurt your baby. Today I would like to explain where that advice has come from and some new data that we have about it. So as pregnancy progresses, especially after about 20 weeks, health professionals often recommend that you avoid prolonged periods of lying flat on your back. And that is because the weight of the growing uterus can compress major blood vessels, and this can lead to decreased maternal blood pressure and reduced uterine blood flow. So this is why many guideline bodies suggest that you avoid prolonged supine rest, supine being lying on your back, avoid motionless supine exercise later in pregnancy, and to switch to side lying or upright positions for comfort and circulation. That advice is reasonable based on physiology, and it's also thought to help prevent dizziness, lightheadedness, and an uneasy feeling that you might experience when you lie flat for too long. Now, let's look at a recent paper that has been making the rounds. This large survey of 679 people who trained with heavy resistance, which is more than 80% of their 1 rep max during pregnancy, found something really interesting. Most participants reported no complications during pregnancy or delivery, whether they engaged in Olympic lifts, supine weightlifting, or not. So in other words, participating in short bouts of supine weightlifting or supine exercise within a broader resistance program did not increase adverse pregnancy outcomes in this sample. So this does not mean lying on your back for 20 minutes every session is proven safe, but it does suggest that short periods in a supine position as part of resistance training did not, on their own, correlate with worse outcomes in a real-world group of recreational athletes. Now, it is really important to highlight how this study was designed. It is a self-reported online survey and not a randomized controlled trial. It doesn't establish safety for all pregnancy stages or populations, and it doesn't replace clinical guidelines. It just shows that this specific behavior wasn't associated with negative outcomes in this group. So think of this as reassurance that brief supine exercise, should you wish to do that, isn't automatically harmful, but it is not a blanket clearance to lie flat for extended periods without paying attention to comfort or physiology. So even though this study didn't find harm in a survey context, there are still good reasons most pregnancy exercise guidelines suggest modifying or avoiding prolonged supine positions, especially in the second half of pregnancy. One of those reasons is aortocaval compression. So when you lie flat, especially after 20 weeks or so, the uterus can compress the aorta and inferior vena cava, and this can reduce venous return to the heart, it can lower blood pressure, it can reduce blood flow back to the placenta, it could trigger dizziness or nausea. This is a real physiological effect documented in multiple studies and guideline reviews, even if it doesn't always lead to adverse outcomes for every individual. Because symptoms are indicators, so if supine exercise makes you dizzy, lightheaded, short of breath, uncomfortable, then that's your body signaling that this position isn't optimal right now, and that's okay. Now, duration does matter. A short moment of supine, for example, a bench press rep set or brief rest, is probably about 30 seconds. And that is far less concerning than lying flat and motionless for 10 to 20 plus minutes without monitoring your body's responses. So while a few reps in a supine position during a strength session might be okay in early pregnancy, extended supine rest or supine conditioning sessions are what most prenatal programs avoid. But honestly, that doesn't matter too much because there are some great alternatives that preserve safety and comfort, especially in mid to late pregnancy. Most benches adjust. You can incline that bench and still be able to complete a bench press that will give you all the benefits of whether you were doing it lying flat. You could also put pillows behind you, which is going to slightly elevate that position, help prevent vena caval compression. Side lying variations can be a great option as well. Standing core options are fantastic to replace core work that is done lying flat on your back. And honestly, if you have been working with me or following me for a while, you will know that these are the options that I give you anyway, because your core functions as a team and you're going to get a bit more out of your core work if you're standing up and moving around as opposed to lying flat on your back. However, that is a whole other video. And you can, of course, do movements elevated. So a push-up, for example, on a bench or a table is a fantastic alternative and eliminates any supine time. The most important rule: listen to your body. This cannot be overstated when exercising during pregnancy. If a movement feels good, safe, comfortable, not making you dizzy, not bringing up any other symptoms, then it's likely a reasonable variation for you right now. And if it doesn't feel good, you don't need a moral reason to stop. You just need awareness and adjustment. Your body is telling you what it needs, and especially in pregnancy, comfort and safety take priority over dogmatic rules. So your main takeaways: short bouts of supine exercise as part of a resistance training session did not show worse outcomes in a large survey of pregnant lifters. Prolonged supine positioning is avoided in guidelines because of physiological changes that can affect blood flow and comfort. Symptoms like dizziness or nausea are your body's cue to change position. There is an alternative for any exercise that can give you the same benefit with less physiological stress. And you should always work within what feels comfortable and safe, especially in late pregnancy. Now, movement shouldn't be scary, and this is why I am sharing this study with you, because I want to give you a little bit more confidence. Movement should be supported, comfortable, and informed by evidence. Short moments of lying on your back, probably okay for so many people, especially early on. Long, static, supine sessions, that's where we would make smart modifications. So remember, it is your body, your choice. I am just here to help you make informed ones.